I can tell you, if there are no questions about that, I can discuss with you a little bit about why we might do the sleeve versus why we might do the gastric bypass. A lot of that will have to do with your own personal medical history. So when you come to the office and meet with Dr. Polo or myself, we'll talk to you about all the medical problems you have or don't have, and we'll talk to you about what operation might be the best for you. The sleeve is a very good operation, but it's very new compared to the gastric bypass. The gastric bypass has been around in large scale for 30 years or so. So we all know patients who have had the gastric bypass decades ago and are still doing great. They still have they've kept the weight that they've lost off. With the sleeve, we don't really know. We've both have patients who have done great with the sleeve. I've had a patient who's lost 100% of her excess weight. She's at her ideal body weight and she's still there. But she's only about 2.5 years out from surgery. In 10 years, I don't really know, and none of us know what will happen. Will she begin to gain weight? Will the sleeve stretch? We don't have those answers for the sleeve. So the sleeve is a newer procedure. It seems to be effective at weight loss. It seems to be very effective also at treating the medical problems that go along with obesity. We just don't know really yet what the long-term results are. And I should mention just some of the reasons why you might have the sleeve versus the bypass. In some patients who have certain illnesses where they might take medications which could cause you to have an ulcer if you have a gastric bypass, so certain rheumatologic conditions where you're taking steroids chronically or non-steroidal anti-inflammatory medications chronically, so things like lupus or rheumatoid arthritis. Sometimes those patients are better off getting a sleeve gastrectomy because they're not as high a risk of getting an ulcer as they might be with gastric bypass. On the other hand, patients who have really significant gastroesophageal reflux disease or heartburn, sometimes the heartburn can cause other consequences, so changes in the lining of the esophagus. Patients like that are probably not good candidates for the sleeve, and they should have the gastric bypass because the gastric bypass can really in almost most cases, cure gastroesophageal reflux disease or heartburn. Are there any questions? Yes.
You said something about you don't know if the stomach could stretch again?
Well, we do know that it can stretch.
It can stretch?
Yeah, with a sleeve gastrectomy in particular, there are studies that show that it can stretch. And so the debate is out there now among surgeons. What do we do about that? When it stretches, does that mean the patient is going to gain weight again? We don't even know that. We know that some patients who do have that stretch, they do gain that weight. So some surgeons have tried to trim it again. But as a society of surgeons, we don't really know what the best answers are yet. We're still finding out. So if you're interested in an operation, which seems to be a very good operation, but you know that we don't have all the answers about it yet, and you're willing to assume some of that risk, then it might be a good operation for you. Whereas with the gastric bypass, we know that little pouch really doesn't stretch, okay? And we know that because even with patients who gain weight years and years after surgery, if they change their eating habits and they're eating more of the wrong types of foods, we can do an X-ray study, an upper GI study, where the patient will swallow some X-ray contrast. We take X-ray pictures, and that little pouch is the same size. So it's just that the food habits and dietary habits have changed. So the question was about in the bypass about how we don't take out, the question was, do we take out anything in the bypass about taking out the intestine? We don't actually take that out, but we do rearrange the intestine in a way in the bypass where food is not absorbed through there. Whereas in the sleeve gastrectomy, we don't arrange the intestine. So is the weight loss different? And yes, there is probably a slight difference in weight loss. We do think that the sleeve is not quite as good at weight loss as the bypass is. With the bypass, you're likely to lose about 60 to 80% of your excess weight. So if you're 100 pounds overweight, you're pretty likely to lose 60 to 80 pounds with a bypass. With a sleeve, you're likely to lose about 50 to 70% of your excess weight. So 50 to 70 pounds if you're 100 pounds overweight. Any other questions? Yes?
Would that vary with different people though?
It varies greatly. So the question was, does the amount of weight loss, does that vary And it varies with every patient. Every patient is a little bit different. Some patients have a lot to lose, some patients have little to lose. Some patients have a lot of other medical problems that prevent them from exercising as much as other people do. And some of the changes or differences between people, we just don't really know why. Some people will go on after that honeymoon period where you're really not hungry for about a year after surgery. And that's with the bypass or the sleeve. Some people then do go on to eat again and get their hunger back, and we don't really know why. That's a minority of patients. But there's a lot of variability. There's a lot of variability. There's a question back here.
Do you have to take the same portion of vitamins as with the bypass?
Very good question. So the question was, do you have to take the same vitamins and minerals that you do with the bypass as you do with the sleeve? And the answer is yes. So right now, as a society, we're recommending the same multivitamin and iron and calcium and vitamin B complex for both the sleeve and the bypass. With the sleeve, I didn't point this out during the video, but with the sleeve, we affect part of the stomach that has to do with vitamin B12 absorption. So that's probably much more important than with the sleeve as compared to some of the other vitamins and minerals. But they're still important, and you still take the same supplements.